Hello, my name is Christina and I'm a pediatric pharmacist here at Orlando Health Arnold Palmer Hospital for Children. I'm going to talk to you today about how to use Diazepam, or Valtoco, which is a rescue medication for seizures that is given in the nose. It's important that all members of the family and the patient watch this video to fully understand how to give this medication so that everybody is prepared in an emergency situation. Diazepam should be given as a rescue seizure medication if your child has seizure activity or clusters of seizure activity that lasts at least 3 minutes or is prescribed by your doctor. Seizure activity can look differently for different patients and may present as full body shaking, shaking in only one part of the body or one side of the body, or staring spells. The medication works by slowing the electrical activity in the brain to stop and prevent seizure activity. It's important to wait the amount of time defined by your neurologist before giving this medication, because many seizures will stop on their own without the need for medication. The nasal spray device has a nozzle here and a plunger at the bottom here. The number of nasal spray devices to give depends on the dose of the medication. The correct number of nasal spray devices per dose, either 1 or 2, will be contained in one blister pack. The medication and supplies should be in a safe and easy spot to get to if you need to get to them right away. If your child starts to have a seizure or show seizure activity, shout for help if anyone else is around and place them gently on the floor. Make sure to turn them on their side to ensure that they do not choke on any vomit, and if possible, put something soft under their head like a sweatshirt or a towel to protect them from injury. At this point, start a timer and grab the emergency medication in case the seizure lasts longer than the designated time frame. Open the blister pack by peeling back the corner tab with the arrow and remove the nasal spray device. Hold the nasal spray device with the thumb on the bottom of the plunger and the first and middle fingers on either side of the nozzle. Do not prime or press the plunger yet, or you will lose the medication. Insert the tip of the nozzle into one nostril until your fingers are against the bottom of the nose. Press the bottom of the plunger firmly with your thumb to give the medication. The child does not need to breathe deeply when the medication is given. Remove the nasal spray device from the nose after giving the intranasal diazepam. If your child's dose requires a second nasal spray device, repeat these steps with the second device and spray in the other nostril to give the full dose. After the medication is given, write down the time that the seizure started and the time that the medication was given. Make sure to always follow your doctor's instructions for when to call 911. If you have not yet received these instructions, be sure to discuss the emergency seizure plan and instructions on when to call 911 with your doctor. It is not recommended to give this medication again until 4 hours after that first dose, unless you are told differently by your neurologist or emergency personnel. The most common side effects to this medication include nasal discomfort, tiredness, headache, and dizziness. While it's very important to be aware of these possible side effects, remember that the benefit that this medication has by stopping seizure activity outweighs the risk of any potential side effects. If your child does experience any possible side effects, make sure that you tell medical professionals right away. Make sure that your child has the intranasal diazepam near them at all times in case it is needed. Store the medication at room temperature, away from young children, and away from excess heat or moisture. Do not refrigerate this medicine or keep it in the car where it may get way too hot. Make note of the expiration date when you first pick up the medication, and always have one available that is not expired. Take the intranasal diazepam to the emergency room or give it to medical professionals that arrive in the ambulance so they can dispose of it, and they will know exactly how much medication your child has been given. If you need to dispose of nasal spray device yourself after it has been used, you can throw it away in the trash can. If you have any questions about what you learned today in this video, please talk to your nurse, and a pharmacist can come discuss any medication or administration specific questions with you and your family. Thank you for watching. Goodbye.